This month is National Cerebral Palsy Awareness Month. Doctors across the state, specifically in Tampa, they're working to bring awareness to this disease. Joining me now to explain more about it and the symptoms is News Channel 5's medical expert, Dr. David Soria. Nice to see you today.
You too.
First off, for those who are not necessarily familiar with cerebral palsy, take me through what it is and then also the symptoms.
Sure. Well, cerebral palsy is actually more common than most people think. There's over 200,000 new cases every year. So it's out there. The tough part about it is that there's really nothing that tells you that it's on its way, meaning that there's no warning signs or things that say, uh-oh, you're about to give birth to a baby with this disease, or things that can prevent it. So it is congenital, and it is essentially secondary to certain risk factors or certain things that can cause damage or injury to the brain. And what it is a disorder of movement, muscle tone, and posture that can remain and last throughout the entire patient's life. And typically risk factors for it include like oxygen deficiency, sometime during either pregnancy or at delivery, infections during birth, seizure disorders, things of that nature, certain exposure to toxins. We don't really have a direct correlation. In other words, if this occurs during pregnancy, then this most likely will cause cerebral palsy.
But is it normally diagnosed during early on childhood?
That's right. It's not diagnosed during pregnancy or even on delivery. It's typically something that is diagnosed throughout a child's progression as far as watching and determining their motor function and developmental milestones. So typically what you'll see is abnormal or delayed progression in crawling, rolling over, sitting, standing, and walking.
And those are the key symptoms to look for. I know that we mentioned that doctors in Tampa, but even here, doctors yourself, locally, you guys are working to bring more awareness to this issue.
Oh, no question about it. Because it is something that's out there, because there are effective treatments, at least to improve quality of life, improve their ability to function in their adult lives, it's important to identify it early, use physical and occupational therapy, and just help them improve so that they can be a little bit more independent as they age.
All right, Dr. Soria, thanks for that awareness. And we have some information right there on your screen. Again, affecting approximately 800,000 people, detected very early on in kids, but this is something that you can certainly get through. There are various treatments.